Hello, good morning, good
大
afternoon,
家
good
好，
evening.
早上好，
Thank
下
you
午
to
好，
everyone
晚上
who's
好。
joining us for this
感谢所有
webinar
人
on
能够参加
oral
这
health
个
and comprehensive
口腔
oral
健
care.
康以及
I am
唇腭
Savannah
裂
Schaefer,
护理网络
President
研
and
讨会，
CEO of
我是
Smile
Susanna
Train, the
Schaefer，
world's largest
全球
bioclip
唇
and
腭
palate
裂研
organization.
究组织微笑列车
Today,
的
you'll be
总
hearing
裁
from
兼
me,
首
Cleft
席
and oral health
执行
experts
官。
from around the world,
今天
colleagues at
您将听
FDI
到我
and
和世界各地
GSK
的
as
唇
we
腭裂
present
与
new
口腔
guidelines
健
that
康专
integrate
家以
oral
及
health
世界
and
牙科
dental
联盟
care into the
和
cleft care
格
continuum.
兰苏士克同事的发言。我们将
I'll
为您提
begin by
供针
giving
对
a
唇
little
腭
bit of
裂患者口
background
腔健康
around
指南
Smile
新
Train's
的
work
工作
to
指南。
explain why this partnership between
我先
Smile
跟您
Train
讲一
and
下我们的合作历
FDI
史，为什
and
么
the
这个
board of
微笑列
GSK
车世
is
界
so
牙科
very
联盟
important to us.
和格兰苏士克的
As
合
you
作项
know,
目对我们来
cleft
说
lip
是
and
如此
palate
重
are the
要。
most
大家都
common
知
heart
道，
defects that
唇
we
腭
all
裂
see.
是口腔面
Children
部
with
最
cleft
常见的
can
先
have
天型畸
difficulty
形。
eating,
唇腭裂
walking,
患者在
hearing,
饮食、呼
speaking,
吸、听力、
and
说话
ultimately
能力都
thriving.
有不同程度的障碍。
Since 1999, Smile
从
Train has
1999
partnered
年起，
directly with
微
dental
小列车已
hospitals
经跟
in
90
more
多
than
个国家
90
的医院
countries,
进行合
empowering
作，
local medical professionals
为当
with
地医护人
funding,
员提供
resources,
必要
and the
的资
training
金、资
necessary to
源
provide
和
cleft
培训，
surgery and ongoing cleft
为其社
rehabilitation
区的唇腭裂患者提供手术和各种护理服务。
We're not a mission-based
我们的
organization.
目标呢，
We
不是
believe
组织一个
that
单独的
increasing
项目，
healthcare
而是我们
capacity
相信，
through
在
local
通过与
partnerships
每
is
个
the
国
most
家战略
sustainable
伙
way
伴的
to
合
support
作
medical
在一起，
professionals
提
and
高
patients
医疗保健
now
能力，并且
and
支
in
持
the
当地
future.
的医疗人员和患者。
After more than 2 decades of working
在
with
与我
our
们的
partners,
合作伙伴一起
after
进行
supporting
了
more than
20多年的努力之
1.5
后，
million surgical
在支
cases,
持了超过
thousands
150
of cleft
万例
surgeries,
外科手术治
we
疗
gained
和
a
1000
great
万个
deal of
唇腭裂
experience and
护理
expertise
治疗以
in
后，
what it
我们
takes
很好的
to
了解
provide
了
the
唇
best
腭裂患者
outcomes
的
for
需求
patients
以及如何
and
给他们一
us.
个好的治疗。
There is an urgent need for not only trained and equipped
目
surgeons
前我
and
们不仅
physicians,
需要
but
有
for
经验的
integrated
外科
cleft
医生
teams
和
that
麻
can
醉
provide
师，
the
而且
necessary
我们也
range
需
of
要能
care
够
throughout
在
the
孩子的
life
一
cycle.
生当中提供必须的
Oral
护
health
理和
professionals
综
are
合
a
性
critical part of this
唇
team.
腭裂医疗团队。
Children with
口腔医生和护士
cleft
们也是这个团队
increased
不可
risk
缺少的
of
成员，
oral
因为
health.
儿童唇
My
腭裂患
colleague,
者
Dr.
口腔
Peter
疾病
Mosley,
风
will
险
go
也有
into
大大
more
的增加。
detail on the
我的
medical
同事
impact of cleft.
Peter
But the
Mosley 医生等一
reality
会儿会继
is
续
that
描述
without
一些
dedicated
唇
cleft
腭裂的
care,
医疗问题。
the outcome of
不过现实
patients'
是，
cleft
如果没有
surgery
专门的
and their
口腔保健
ability
服
to
务，
eat,
经过唇腭裂
speak,
手
and
术的
live
患者们的
without
进
pain
食、
or
说话和生
discomfort
活
is compromised.
都会受到影响。
It is critical that all individuals with
因
cleft
此
have access
是
to
如此
quality
重要，唇腭
professionals
裂
who
患者
are
能够
aware
得
of
到
their
了解
needs
他们问题的
and that
口腔医生
every
护理，
member of the
并
cleft
且
care
整个医疗
team
团队
knows when to
都
refer
要
patients
理
back
解
to their
口
oral
腔护理对
provider.
这些患者的
It is
重要
critical
性。
that every family
家
understand
庭
their
成员也
role
非常重要，
in
也要
supporting
理
their
解
child's
孩子
oral health
唇腭裂
and that
对口
every
腔发育
parent
的问题，鼓
understands
励孩子
how
加
to
强
take
口腔卫生和
responsibility
护
for
理，
their own health
也需要让
and
每个
the
孩子
health of
随着
their
年龄的
children.
增加，学会对自己的健康
The
负
availability,
责任。
quality, and consistency of
这
this
种口腔
care
护理的可
will
能性、
impact their health
质量
and the
和一致性
trajectory
将
of
影
their
响他们的
entire
健
life.
康以及他们一生的轨
This
迹。
is why Smile Train and FDI, with the support from
这就是为什
GSK,
么
have
微
come
笑列车
together to
世界
develop
牙科联盟和我们的
educational
合作伙
resources
伴
for
格兰
professionals
苏
and
克苏士克
non-professionals
一
alike.
起设计了
Over
为
the
专业
next
人士和
2
非专业
years,
人
we
士
will
不同
continue
教
to
育
work
裁
with
员。
our expert team to develop
在接下来2
guidelines
年
to
中，我
teach
们将
patients
继续
and
与我们
families
的
about
专
the
家团队
importance
合
of
作，
oral
并
health,
开发口腔
explore
患
the
者和家
challenges
庭
of oral health
传授
care
口
beyond
腔健康重要性
cleft
的教育
and
材料。
provide vital guidance and support.
了解唇腭裂手术后的
The
保
guidelines
养
we are presenting
地域的各种
today
挑战，
are
并
built
让患
around
者
the idea
最
that
好
all
的指导
clinicians
和支持。
involved in the
我
care
们
of
今天
the
提出的
cleft
指
surgery
南也
victim
基于这样的一个
have a
思想，
role
就
to
是让
play
所有
in
参与
maintaining
治
a
疗
healthy
唇腭裂
smile.
患者的临床医师
Of
们都
course,
能保
like
持我
any
们
guideline,
患者
you
健
can
康笑
only
容中
have
发
them
挥他们
if
的
paired
专
with
长。 当然了，像任何指南一样，这些规则只有与医学专业人士的奉献精神、经验与知识结合才有价值，才能一起帮助患者过上更幸福、更健康的生活。今天我们想感谢所有改变患者生活的医护人员，包括所有唇腭裂的患者们。世界牙科联盟、微笑列车和格兰苏斯克很荣幸能为您成为全球唇腭裂治疗的重要成员进行支持。我们感谢您的辛勤工作。我们邀请您访问微笑列车新的网页，网页为 smiletrain.com oral health， 以获得更多的口腔护理教育资源。 其中包括很多新的指南，并且通过多年的合作会继续提供新的教育资源。谢谢大家，我们期待与口腔护理界继续合作，以保证每一个有唇腭裂的孩子都能得到他们应有的未来。我现在呢，想邀请 Peter Moshe 医生加入我们，并向大家介绍为什么口腔健康和牙科保健对唇腭裂患者如此重要。谢谢您，苏珊娜。我是 Peter Moshe， 我很荣幸被邀请代表世界牙科联盟和微笑列车任命的专家团队介绍这些急需的指南。所有儿童，无论身处何处，都应拥有一口健康的牙齿，以确保他们的健康。这是一项基本人权。这意味着要有健康的饮食习惯、良好的口腔卫生和涂氟治疗，以及定期获得专业的口腔护理。因此，我们今天呢要讨论一个困扰非常特殊的人群的一个口腔问题，这就是这些唇腭裂患者。由于某些原因，这些儿童是更容易患上幼儿龋齿，我们也要了解此原因。这是我们了解关于唇腭裂儿童患者口腔健康不良的一些信息。首先，他们更容易出现一些牙齿异常，例如多余牙齿、缺失牙齿和牙齿畸形。同样，牙槽骨质量更薄，而且在单侧或双侧唇裂合中，中心部位有明显的骨缺损，而且牙釉质缺损也更为普遍。其次，唇腭裂婴儿更容易出现进食问题。首先，他们无法在乳头上形成完全封闭吸乳，在没有适合的营养建议下，他们父母给他们的液体食物中竟然往往有更多的含糖食品。同样，父母经常呢会用盘子来促进进食，在这些盘子及容器里会累积不同的沉淀物，同时食物从口中排出的时间也会更长，这往往呢会从淀粉中产生可发酵的糖，在口腔内给口腔内的细菌提供食物。第三，在个别情况下还有一些另系列的因素。这些孩子们因为贫困、社会蔑视以及不同的地理障碍，唇腭裂患者经常很难获得正规的口腔护理。由于唇腭裂，患者们也对自己的口腔带着焦急的心理，让综合性的生活质量会有下降。最后呢，他们也更有可能接受更长时间的正畸治疗。那么这个问题呢，我们怎么去解决？来自世界牙科联盟、微笑列车和格兰苏斯克的工作人员，我们呢也团结了起来，为医护人员定制了一套指南指导方针。在下面的讲演中呢，Omurura Orenuga 医生将介绍这些内容的实质，并且该指南确保我们能够减少手术后的不良影响，营养不良、疼痛以及我们患者的语言、心理及生活质量问题。 总而言之，该项目的整个想法就是支持科学团队的各个成员，以确保唇腭裂患者们感到支持和关心，并能够为他们取得最佳的治疗效果。这个呢，就包括了一个健康的微笑。因此呢，他们呢才有能力去发挥自己的全部生活潜力。好吧，那我现在呢把讲演交给Omurura Orenuga 医生，我衷心感谢您的关注，谢谢。谢谢您，莫水教授。今天呢，我也很荣幸成为 FDI 世界牙科联盟和微笑列车任命的专家小组成员，为口腔专业人士和更广阔的唇腭裂治疗团队准备口腔护理指南。从2020年2月到2020年7月Sri Ramachandra 研究所的Mudan Murugan 教授与唇腭裂口腔健康专家小组合作，对现有文献进行了系统评价，并发布了有关唇腭裂患者口腔护理指南。使用 Agree-2 临床指南研究与评估系统2进行评估，也确定了7项指导方针。研究人员得到结论是，现在所有的指南质量低至中等，没有办法对唇腭裂患者护理的多学科团队提供全方面指南。该论文将于2020年末发布。FDI 世界牙科联盟和微笑列车意识到，为唇腭裂患者提供的护理的每一个医护人员都有责任确保患者拥有一个良好的口腔卫生。父母或监护人可能需要更多的支持和鼓励，学习如何清洁唇腭裂处周围的清洁。患者呢也要学好自己口腔卫生。8岁以下的孩子们需要在日常口腔卫生中获得支持和鼓励。关于唇腭裂，现存呢有不同评估方式。FDI 世界牙科联盟和微笑列车采用的是 LASAL 系统，称为 LASAL 的评估系统基于解剖学，分类是使用唇 L、牙槽 A、硬 H 和软 S 上颚来描述唇腭裂的特征。第一个字母代表呢患者的右唇，最后一个字母呢代表患者左唇。LASAL 代表显示大写字母呢是完全分裂，小写字母呢是不完全分裂，如果没有分裂，而是用破折号显示。我们所以使用 LASAL 评估系统，就是因为它能良好的为口腔界和非口腔界专业人士理解唇腭裂这个程度。指南中包括最关键的信息，就是所有护理唇腭裂的医护人员都要遵守的一项规则，就是要非常重要的保护、维护患者的口腔健康。因此呢，为这个医护人员开发并提供相当的学术交流也是非常重要的。这种跨学科交流的目的呢，就是优化患者的口腔健康和幸福感，包括进食、说话、呼吸、吞咽的能力。医护人员呢，应该支持孩子监护人，因为他们呢也非常担心孩子牙齿的外观以及孩子的口腔健康。父母和监护人呢都要好好学习如何清理唇腭裂处，也要好好了解都有什么不同的因素可能造成口腔疾病的出现和如何避免这个疾病的出现。在我们患者的整个生涯里，他们还会接受很多其他专业的治疗，包括基因测试、语言治疗、听力测试、 不同手术和外科复查。整个治疗团队都需要定期进行沟通，以确保患者在正确时间得到正确的治疗和护理。如果他们对患者的口腔健康或者口腔的发育有任何疑问，也要及时联系。口腔专业人士和非口腔专业人士的指南呢，都是按年龄段分裂的。首先呢是0到2岁，然后2到6岁，6到12岁，12到18岁和18岁以上。这个指南呢会给患者一生中不同的医护小组都提供指导。本指南中对口腔专业人士的关键信息呢，就是微创牙科治疗方案，以保留牙齿天然牙质为主。如果可以的话呢，是可以使用氟化2胺银，并且要鼓励经常涂氟治疗。在这些儿童中进行儿童早期龋齿的监测和评估也是非常重要的，因为儿童早期龋齿可能给唇腭裂儿童患者带来高度的心理压力。在与每个患者见面时，应该给患者很严格的口腔卫生护理指导。随着患者的成长，会需要呢从口腔闭孔器转移到移动正畸器具，然后呢再转移到固定正畸器具。所以呢，我们给孩子的注意事项也要有所改变。唇腭裂患者呢也经常遭受长期的心理影响，因此呢，在必要时期也要给他们适当的心理医生支持。作为口腔医生呢，我们责任呢也包括为他们提供适当的义齿，并提供微创美容治疗，例如树脂修复。对于非口腔医护专业人员呢，他们也能利用这个指南评估发生口腔疾病的风险。风险评估的项目呢，包括先前的龋齿出现，社会经济地位低，频繁饮食糖果，唾液流量或者唾液 pH 值降低，口腔卫生差，氟化物欠缺，熟悉的危险因素，例如父母的学历或兄弟姊妹的口腔健康。我们应该意识到，风险评估中的每个项目都会增加患者患口腔疾病的风险，而且这些项目的组合会出现呢，就是它会大大增加蛀牙和牙周疾病的风险。非口腔医护人员的主要注意事项信息呢，就是要评估患者口腔疾病的风险，并确保呢开处方药时这些药物不能含糖。我们呢还建议他们所谓的抬起嘴唇，每次拜访患者时都要给他们做一个简单的口腔检查。我们非口腔医疗护士、医疗同事可以针对下面进行一个评估牙齿。怎么评估呢？牙齿白斑、棕斑、牙龈出血、牙龈红、蛀牙和牙菌斑堆积。我们把这个简单的检查称为抬起嘴唇。我们还可以利用这个机会，每天建议患者呢2次刷牙，这是非常重要的。刷牙后呢，不要漱口。避免在2餐之间呢吃零食，并建议食用酸奶、奶酪或者不促进蛀牙形成的一些食物。2餐之间只能喝水呢或牛奶，和及时去牙医检查。 随着患者的成长呢，是非常重要好好教患者的这个口腔护理技巧。从出生开始，每次喂奶后呢，早晚都要擦唇腭裂的周围。随着第一颗牙齿的成长呢，我们也要帮助孩子刷牙，并且直到8岁，我们都要监督孩子的刷牙和口腔卫生护理。在青春期期间，他们呢经常会接受正畸治疗，因此呢，我们也要好好的教他们怎么样刷牙，并且保持这个牙套清洁。在成年后，他们可能已经接受了高级修复治疗，比如固定桥以及种植体。这就需要更专业的家庭护理，在以防以后可能出现的一些问题。作为口腔专业人士，我们有责任来维护我们患者的口腔健康。在格兰苏斯克的支持下， FDI 世界牙科联盟和微笑列车很高兴今天发布这个指南，以改善患有唇腭裂的儿童的口腔健康。现在呢，我会将把讲演交给 FDI 世界牙科联盟主席 Gerhard Sieberger 医生。谢谢。谢谢欧仁诺嘎医生。大家下午好，我很高兴大家能参与我们今天的网络论讨会。首先，我想简单介绍一下我们支持唇腭裂儿童的口腔健康和牙科保健所做工作。在2019年 FDI 世界牙科联盟很荣幸与口腔健康非营利组织微笑列车合作，合手改善唇腭裂患者的口腔护理。在格兰苏斯克的支持下，我们已经启动了口腔健康与唇腭裂患者综合护理项目。该项目将口腔科医护人员融入在了唇腭裂治疗团队里。该项目呢，为口腔界专业人士甚至更广阔的唇腭裂护理团队、父母和护理人员提供教育材料。今天我们很高兴呢，也介绍一个全球专家团队的工作。该团队已经定制了唇腭裂患者的口腔全面的护理指南。这些指南也会为唇腭裂患者显示如何防御口腔疾病，如何保护自己的健康的牙齿。唇腭裂儿童的龋齿和牙周疾病的风险明显更高，经常即使他们接受了这个必要的手术，他们应会有一些缺少牙齿或牙齿畸形。作为口腔医疗专业人士，我们意识到口腔疾病对儿童和成年的口腔健康、生理发育和个人幸福有了很长期的影响。我们相信呢，这些患者需要多学科医疗保健，口腔保健专业人士也必须接受明准的指导和教育，才能照顾好我们的唇腭裂患者。FDI 世界牙科联盟作为全球超过100万牙医的代表，与微笑列车，并在格兰苏斯克的支持下，对整个口腔界人士表示诚挚的谢意，感谢他们继续致力于解决全球口腔疾病负担和改善人民群众的口腔健康。谢谢您加入我们。每年有20多万婴儿出生时有先天唇腭裂，唇腭裂儿童在成长期会有增加蛀牙、牙周疾病和其他口腔疾病的风险。但是在中低收入国家里，很多儿童无法获得基本的口腔医疗服务。如果没有熟悉他们独特需求的医疗专家进行口腔护理，患有唇腭裂的儿童可能会难以说话和进食，缺乏适当的护理，甚至可能威胁到未来手术的成功。从孩子首次的口腔预防保健检查到以后的正畸和口腔修复，高质量的口腔治疗是唇腭裂儿童患者幸福和未来健康的地基。 牙医也是其护理团队重要成员。因此，在格兰苏什克和格兰苏什克消费者医疗保障部门支持下，微笑列车和 FDI 世界牙科联盟共同开发了关于唇腭裂口腔健康的项目。我们将同口腔专业人士一起来解决唇腭裂患者的口腔健康需求。我们将与口腔界一起努力，以让所有的孩子获得基本医疗保障的机会，并确保不有任何儿童落伍。微笑列车、FDI 世界牙科联盟和格兰苏什克非常荣幸地认可和支持口腔界专业人士作为全球唇腭裂治疗团队的重要成员。对于无数的牙科专家们，我们也每天都不断改善这些唇腭裂孩子们的生活。谢谢您。谢谢您，哥好，大家好，大家下午好。这个视频确实显示了牙科专业人士在改善每年出生的近20万唇腭裂婴儿的护理方面所起的至关重要作用。我们非常荣幸能够代表格兰苏什克消费者医疗保健部门名义提供支持。在格兰苏什克，我们的团队精神就是通过科学的产品和服务来解决口腔保健中的各种难题。我们相信我们的嘴巴应该是快乐的源泉，而不是痛苦的原因。因此呢，我们与微笑列车有一个共同目标，这是为什么在这2年半前我们建立的合作伙伴关系，以帮助改善唇腭裂患者的护理，从此呢使他们过上更健康、更美丽的生活。对我们来说呢，这就是做一件好事。在过去的2年半中呢，我们支持了8000多例改变生命的唇腭裂手术。我们呢还赞助了全面的唇腭裂护理计划，并在为这些患者提供全面的护理疗程。我们也相信呢这个微笑列车的发展模式，因此呢，在全球52个国家与地区，为2000多名牙医、外科医生、护士、麻醉师、语言治疗师和营养师的培训方面投入了大量精力。在格兰苏什克，我们为我们的和FDI 全球牙科联盟的合作感到骄傲。在过去的10年里，我们共同实现了以科学为主的不同项目，例如全球牙周健康计划和口腔健康观察站。因此呢，在实现改善唇腭裂护理项目的过程中呢，今天我也为世界牙科联盟和微笑列车的合作开发唇腭裂患者口腔健康指南感到非常骄傲。我们知道呢，唇腭裂患者们龋齿和牙周疾病的风险都明显较高，但事实呢其实不一定永远都需要这样。通过献给像您的循证医学证据，我们可以一起呢为这个唇腭裂患者提供更好的护理，并帮助他们改善他们的人生，改善他们家庭的生活。这些预防唇腭裂患者口腔疾病的指南呢，也是我们共同努力中的又一大步骤。这样呢，我们能把牙科专业人士与唇腭裂患者连接在一起。我们目前呢正在印度进行初步测试，不过不久将来我们也会在墨西哥和尼日利亚进行初步测试。我们呢还有很多事情要做，当然了， 通过像您们一样的口腔医生的合作，我相信我们可能做出重大的贡献。我现在呢，想将网络论讨会的信号转给 Peter Mosey 教授，他将带您完成问答环节。谢谢您，非常感谢。
So thank you very much, everyone who has joined today's webinar. And you will note that we now are ready to accept questions. We've got myself, Peter Mosey. I've got Dr. Lola Oranuga, Dr. Susanna Schaefer. And I'm going to start off just briefly with Dr. Gerhard Seeberger, who is the president of the International Dental Federation. And I think today you're witnessing a unique collaboration between organizations to make this possible. And I'm going to ask Dr. Seeberger just to just explain how this came about, this unique collaboration.
Yeah, thank you, Peter, for introducing me so nicely, and thank you to Lola and to Susanna for being with me. And why is it that we are sitting together? So let me tell you a little story. Since 2018, GSK Healthcare is a strategic partner of SmileTrain. And it's not only that they gave financial support to SmileTrain for their global Cleft programs in order to bring smiles to so many people around the world, but they also support global awareness building around cleft lip and palate and oral health. And part of SmileTrain's strategic plan is to expand their programs to offer every facet of comprehensive cleft care to every patient in need. And this includes a 360 degrees oral health care. To support this plan, GSK arranged an incredible opportunity introducing SmileTrain to the long-standing partner, the FDI, World Dental Federation. And we were very happy. I need to tell you that. There's a huge need for high-quality comprehensive resources on cleft care and oral health. And as SmileTrain and FDI share their passion for enabling healthy, happy lives through all healthcare, it was almost a must to come together to address this need. With GSK's crucial support, SmileTrain and FDI have joined forces to support people with clefts and medical professionals through this groundbreaking two-year project. So that's all what I can tell you so far, and I give the word back to Peter.
Thank you very much, Gerhard. And we're delighted to see so much contribution through the chat box, and we will now proceed to take your questions. And between this panel, we will hopefully be able to elaborate further on these guidelines and other aspects of comprehensive cleft care. The very first question, in fact, is an interesting one, just asking about percentage of babies born worldwide with the condition of cleft lip and palate. And of course, the orofacial clefts are a broad and range of different conditions, and totally, when they're taken as a whole, account for 1 in 700 live births. That's an aggregate statistic across the world, and there is variation. As one of the other questions asked, is there a world map that shows the variation? And indeed there are world maps, one of which is on the FDI Vision 2020 website that you can maybe access. But it shows that the highest rates of cleft lip and palate in the world tend to be in the eastern areas, Japan, China, parts of India seem to have high prevalence. The lowest rates in the world, interestingly, are in Sub-Saharan Africa, and then intermediate rates among the Caucasian populations, Hispanic populations, and therefore there is geographic and ethnic variation. So I'll take the next question in relation to, it's a clinical question about treatment planning, and that will be something of interest, great interest to Lola, and I'll ask her to deal with treatment planning in cleft care in oral health.
Well, thank
Lola.
you very much. Thank you very much, Peter. Yeah. This question has to do with what are the things we should keep in mind while treatment planning. We should note that as oral health professionals, the role of the dentist is very essential, especially where preventive care is concerned, prevention of oral health diseases, in particular dental caries, which is of a greater higher burden in these children. And then more importantly as well, they have a lot of other problems that come into play there. The speech, psychosocial, and a lot of concerns about eruption of teeth. A number of these items are dealt with in the guidelines and are available online at the SmileTrain website, as well as the FDI website in English. So, and most importantly, as oral health professionals, we should collaborate effectively with the other care providers in making sure that these children get the best at the right time. I hope that answers that question.
That's very good signposting to the guidelines, and I'll just move on to the very interesting question that relates to the high incidence and the access problems in places where they are low to middle income countries such as India. And in fact, a similar question arose in the context of Sub-Saharan Africa or Nigeria. So I know that Susanna is very interested in this particular aspect. And if I can ask Susanna to respond.
Sure. Thank you, Peter. So if, there's more need to understand more, you can always visit SmileTrain India or SmileTrain Africa's program websites. It would either be smiletrainindia.org or smiletrainafrica.org. And there you can find information about hospitals that partner with SmileTrain. At some hospitals, SmileTrain offers grants to cover patient transport to and from treatment, including surgery, speech therapy, and orthodontics. Dental care grants are not yet available. However, the goal of the new oral health and comprehensive cleft care guidelines and the upcoming education resources from FDI, GSK, and SmileTrain is to set the foundation for this grant program in the near future. So please stay in touch with SmileTrain to learn more as these become available. And again, you can visit either websites, smiletrainindia.org or smiletrainafrica.org.
Thank you very much, Susanna. And
Sure.
let me take the next question myself. It's related to the diagnosis before a child is born. And we refer to that as prenatal diagnosis. And indeed, it is possible through ultrasound to identify a cleft as early as 12 to 15 weeks. The difference, however, is that while a cleft lip is easily diagnosed by skilled ultrasonographers, cleft palate is not so visible. And indeed, the cleft palate cannot may not be diagnosed until birth or even after birth. But also a range of syndromes and craniofacial abnormalities as well as clefts can be diagnosed in advance. The value of this is the psychological preparation of the family, and they can be prepared for the birth of a child that has this repairable birth defect. And that's extremely important in the comprehensive cleft care, to be prepared for that and to ensure that the family are psychologically prepared, but also have a program of care available. So I'll move from that to another question, which I think is extremely important. It asks about after surgical treatment, what's the value of comprehensive care and good oral health care? And again, Lola may want to contribute to that answer, and I can also add, but Lola. post-surgical care?
For post-surgical care, there are quite a number of problems, apart from the orthodontic aspect, the dental anomalies, the speech, the psychosocial, so the important thing here is we should have agreed protocols in the facilities, and at the same time, effective interdisciplinary collaboration between the experts, and most importantly, the question says why they have to take more concern about it, because because the speech problems and the psychosocial problems that these patients have, so it's very important that they address early, and in particular for the oral health aspect, the emphasis is on prevention, because we don't want to have them developing concerns for need for extractions that will warrant them to have prostheses that are very difficult to manage. So as much as possible, it's better to have prevention is very key. And then the orthodontic aspect too, malocclusion is very important. And all this as well on the guidelines, stated on the guidelines as well. So, yeah.
And just adding, as an orthodontist, as an orthodontist, I know that one of the key words we always say is that the bone is gold and the teeth are even more important than that. So it's very, very important that we have excellent dental care and good quality of teeth and bone, so as to have the optimum outcome. So the prevention aspects that we deal with, even prior to having orthodontic treatment carried out and braces fitted, we ensure good oral hygiene through toothbrushing, regular fluoride applications, and good dietary advice, avoiding sugars and refined carbohydrates. Yeah, and as Lola has just very nicely said, this multidisciplinary communication is so important, so that all aspects can be addressed simultaneously for the best possible outcomes. So we also are now having additional questions, and one that I will ask Susanna just to address is how to join Smile Train as a dental professional. Would you be able to address that, Susanna?
Sure. Well, our programs are Cleft focused, and dental care is obviously being incorporated into our programs. So the best way to stay connected is by visiting our websites, which I had mentioned earlier. So there's smiletrain.org/oral health. And then our regional websites I had mentioned before, smiletrainindia.org and smiletrainafrica.org. We also have websites for Asia, or China, excuse me, and the Americas region. But everything connects back to smiletrain.org. But that is where you can find access to the list of our partner hospitals, and be connected to a Smile Train staff representative who is on the ground or managing a region of countries that can help direct you to our partners. And as we start to bring along our dental programs within our Smile Train Cleft programs, we will be having opportunities to connect with dental care providers. So we're very, very excited for this, and we're so grateful to FDI and to GSK for this wonderful opportunity.
Thanks, Susanna. And actually, the next question from Dr. Professor Ghani from Pakistan is about the contribution of GSK helping the training of general dental practitioners. And maybe Gerhard, in terms of FDI and GSK, the GDP input, I know that's addressed in our guidelines, but you may want to elaborate.
Yes, I mean the domain of the oral health, of the general oral health professional or general practitioner is quite clear to everyone. Take care of the hard and soft tissues, of course. Take care of an adequate hygiene, as you already said it before, Peter. Of course, also dietary advices to stay away from refined carbohydrates and added sugar products. And if you go to processed products, you will probably sometimes wonder that you find sugar also in salad added, and sugar-sweetened beverages. To this, I may add the function of the general dental practitioner. He should definitely be the coordinator between the specialists in order to guarantee the best assistance and care for patients with cleft palate. I would also at this point enlarge a little bit the not only specialists from the medical profession, but as we look also at the assistance during the growth of this child, and of course also through the educational period. So maybe also try to get in touch with speech therapists and not leave that individual to inequalities during the educational part.
Yeah, thank you very much, Gerhard. That's excellent to have that perspective from the general practitioner's viewpoint. Just to address maybe fairly quickly the age of treatment for cleft lips and palates, and also types of surgical procedures. Those are two very good questions. Isolated cleft of the palate is usually treated as early as 6 months, but as late as 12 to 15 months in current practice. And for cleft of the lip, the usual protocol is to close the lip as soon as the child is thriving and is fit for surgery. That's usually around 3 months. So 3 months for a lip closure and 6 to 12 months for a palate closure. In terms of the surgical procedures used to get better success rate, that's an interesting question from the research point of view. And of course, one of the things that Smile Train have recently done is they're really concerned that to improve the quality of cleft care and the surgical and non-surgical care, research is extremely important, research and innovation. So there are currently ongoing efforts to look at how successful the treatment is at the different ages and using different procedures. And that research will be ongoing to improve quality of care as we go forward. And there's one other question I'm noticing about the how can we reduce dental caries and periodontal problems in cleft lip and palate patients? And while Lola has actually addressed that earlier in terms of dental caries, could you also mention the periodontal problems, Lola?
Well, the periodontal problems they have, gingivitis. They have gingivitis. Can have this can if care is not taken, can lead to, especially in Africans, you can have acute necrotizing ulcerative gingivitis as well. Ano, that we refer to ano. And really, the important thing here is that early prevention, so that you don't have the problem coming up. So we educate them about oral health practices, toothbrushing, cleaning the area, the cleft area clean after every feed, and morning and night. And then as the child erupts the teeth, supervised and assisted toothbrushing until the child is of age of 8. And after that, adolescent, age-appropriate devices to be used, toothbrushing. And then when they go through orthodontic treatment as well, you should realize that they'll be having appliances, removable and fixed appliances. They should be taught how to clean the appliances so that they don't have concerns, greater issues later. And then furthermore, They may also have implants, things that are more elaborate, and then these ones actually require special home care as well. So they should be taught how to take it. There should be a protocol on handling these devices, appliances when they do come. So the emphasis is on prevention, you know. So yeah, and being educated on the dietary advice, also dietary counseling, the tooth-friendly foods that are advisable, like fruits, yogurt, and avoiding sugary foods. And then for medications, because a lot of these children prescribed medications, emphasis for the our medical colleagues to prescribe medications that are sugar-free. Yeah.
And that helps
the importance
also
of fluoride as well. The importance of fluoride. Exactly. And if available, use of silver diamine fluoride, especially in the primary dentition. To preserve
that also helps address the question I see that what is the role of the dental hygienist? The dental hygienist, of course, can assist with those aspects that Lola has just outlined. So there's a very special role for the dental hygienist in those. And there are some other aspects that Lola has just addressed, like the one relating to pediatric dentistry input. And it's nice to see that there's such enthusiastic interest to help. You know, those from Nigeria and India are offering, you know, their services in helping with cleft lip and palate prevention and care. The predisposing factors that lead to cleft lip and palate, again, a very interesting question, and of course one that's subjected to comprehensive and global research over the last few decades. And we are learning more and more about both genetic and environmental factors that contribute. So cleft lip and palate is a polygenic multifactorial disorder. So there are contributions from the genes, so genetic influence, and also from these environmental factors such as diet. People often hear about the role of folic acid. This goes beyond folic acid. There are a whole range of other factors in the diet that may be important, multivitamin supplements. There's also the avoidance of smoking in particular and contaminated environments. It may not just be active maternal smoking, it's the exposure to passive smoke or the exposure to contaminated environments. And other predisposing factors that we know about are certain drugs and medications. And these should be part of the prenatal preparation for pregnancy. But in the whole, these genetic and environmental factors can be handled by improving our knowledge, improving our research, identifying the predisposing genes, which we're doing through global research, and then tailoring the environmental factor to minimize the risk. And that's something which I am very interested in and I'm working with colleagues to address. The next few questions relate to cleaning and oral hygiene, which I think we dealt with. And then there's an interesting question that asks about our system for classification, the LaSalle. And I think both myself and Lola are very familiar with this. Lola, do you want to explain it?
Okay. Yeah. Okay, the LaSalle is an anatomical based system, and I think FDI GSA Smile Train adopted it because it's easy to understand by both oral health and non-oral health professionals. The L stands for the lip, the A for the alveolus, the S for the soft palate, H for the hard palate, A for the. So looking from the first L, that's when you're facing the patient. The first L, that's the patient's right. That's the left lip, the right lip, sorry. And then the last L on the other side is the patient's left. Okay. Now, when the you have it in capital letters, L, it means that you have a complete cleft of that L. So if it's on the patient's right, that's complete, and it's in capital L, it means that it has a complete right cleft lip. Okay? So, and but if it's in a small letter, it means that it's incomplete. So when you see capitals, it's complete cleft. If it's lowercase, it's incomplete. But when there is no cleft at all, you have a dash. I think that's it.
That's a very
I'm trying to make it as simple because I don't.
That's tremendous, and the way you've explained it, it shows how logical it is. It's really easy for anyone when they see a picture to be able to apply the LaSalle score, and I think that's the beauty of it. And we're certainly happy to promote that through Smile Train, FDI, and these GSK guidelines.
In addition, the LaSalle tool is very good for research because it allows for coding on the computer. I read that somewhere. Yeah.
And what I describe as sub-phenotyping, so that we have separate types of clefts and separate groups. So you can, and I think that's going to be extremely important when we're looking for genetic predisposition. So it's an important classification.
Yeah.
A simple answer to the gender predilection, again, a very interesting question, but in fact, clefts are characterized by gender biases because isolated cleft palate is more common in females. So about 2/3 of females in the isolated cleft palate incidence, whereas cleft lip and palate is more common in male infants. So there is this gender bias, which we don't really understand. We know it must have a genetic origin because it is so consistent across different populations. So about 70% of cleft lip, either isolated cleft lip or cleft unilateral cleft of the lip and palate, are on the also on the left side. So there's the male predilection and also this the left-sided predilection. There is another question about the aids given to patients of cleft lip and palate by the dental professionals. And again, I'm sure Lola and Susanna and Gerhard would say, if you look at those guidelines, you'll see a comprehensive reference to the kind of aids that we advise. And some of them have been mentioned in the webinar, and also the kinds of treatments, such as the silver diamine fluoride, and those are comprehensively covered within the guidelines. So let me just get to the next couple of questions. Procedures to know about cleft lip or palate intrauterine life. I'm assuming that may be referring to the possibility of intrauterine surgery. Is that what you read from that?
Which question is that?
Procedure, there's one about procedures known for cleft lip and palate and intrauterine life. Well, I do know that this has been speculated as because of scar-free wound healing as a possible method for treatment of clefts, but the big risk and danger is spontaneous abortion after a surgical intervention, and therefore it's not recommended. So we wait until the child is born and carry out the cleft repairs then. And then risk factors that cause morbidity after operation or procedure or surgery. Of course, there are problems ongoing after the surgical repair. And maybe one of the ones that's being referred to there are things like hearing problems, speech problems, the cleft, the alveolar cleft, which is a deficiency of bone, which causes a problem. And then there's the psychological and psychosocial problems. So there are ongoing problems even after the cleft repair. But those, by comprehensive multidisciplinary treatment, can be very effectively managed. So those risk factors or those causes of post-operative problems can be managed. And that's also the growth of the face can be reduced because there's scar tissue in the lip and there's scar tissue in the palate. So again, those growth problems can be addressed using orthodontics, orthopedic procedures, and surgical procedures. So again, we know that we're getting better and better at improving the post-surgical treatments and management. Now, does anybody else want to comment on that before I move to there's a consanguinity question that I would also be happy to comment on. Is it?
Peter, I would just add on that Smile Train's model of sustainability and building capacity in countries immediately addresses what you had just brought up there, in that, you know, our goal and adding in this component now for dental care with the FDI and GSK partnership is just going to help us in the breadth of our programs and what we can support our partners with in low and middle income countries to build comprehensive cleft care programs in their own communities to treat cleft children with ongoing care. So the Smile Train model of empowerment and providing the funding and resources to medical professionals, orthodontists, dental practitioners, building that full comprehensive cleft care team, including the surgical components, psychosocial, nutritional support. It all comes together in a sustainable model. So we're thrilled for this partnership to now be adding the dental component, and are excited, so excited for what's to come in this next year.
Yeah, exactly. We're all looking forward to continuing the partnership and to having Smile Train work with FDI as we go forward, and with all the tremendous support that we've received from people within other sponsored programs, and GSK are a good example of a highly motivated group who have oral health as their major component. So it's a great partnership to build on. There is a question. Yeah.
Their message is doing well by doing good, and this is exactly that. So we're incredibly grateful.
Okay. Yeah.
Yes.
There's just one I just may have the question on the high prevalence of clefts in Sub-Saharan Africa. I may have made a mistake, or else I'll correct it now. The prevalence in Sub-Saharan Africa is actually low. It's the lowest in the world in terms of the recorded clefts. We do also recognize that the ascertainment, as we call it, the diagnosis of all cases as they are born varies in different parts of the world. So the infrastructure for picking up every cleft that's born varies. So maybe, although the recorded prevalence is very low, or rather low in Sub-Saharan Africa, it could be that we're not picking them all up, and we want to continue to improve that aspect of our care as well, to make sure that systems are in place to improve the ascertainment. And the good news on that is that the Sustainable Development Goal Programme has, as part of SDG 3, an aspiration to universal health coverage. And that means that accessibility, availability, and affordability of treatment are its primary objective. So the universal health coverage is receiving a lot of high-level attention at the moment, in not just FDI, but also in WHO and in IADR, the International Association for Dental Research. And they want to come together as a partnership to ensure that the Sustainable Development Goals are delivered by 2030. And that would improve access in the most deprived areas of the world. So I think we've another question on the guidelines, which it was addressed earlier on, that we do have both in the FDI and Smile Train sites, we have reference to those.
That's correct. They are translated on the Smile Train website now, and FDI is in English, but translation will be coming.
Right.
Very good.
Okay, there's a question for me here.
Oh, yes. Yeah, please, Lola. Yes, the one on education.
No, it says dental home.
Oh, yes. Yeah, please.
It's like, would it also be, okay, yeah, the question about dental home, actually, as pediatric dentists, we advocate that as early as possible, the child should be taken to see the dentist, preferably before the first birthday or as soon as the first tooth erodes. And it's very good that a dental home is established by the time the child is 1 year old, so as to encourage, familiarization with dental practice. It's very important, and it will go a long way to support children with cleft. And at the same time, the non-oral health professionals can also encourage them to visit the dentist, apart from doing the lift the lip that was mentioned.
Indeed, yeah. And actually, I see a question referring to the reasons for cleft children being more likely to have oral health problems. And caries. Do you want to say something about that as well, Lola?
Well, because of the anatomy of the cleft, you could have food debris around that area, or the milk around that area, and if the caregivers are not cleaning properly, that could lead to predisposing the child to oral health problems. And then moreover, we talk about medications that they're being given regularly, especially if they're sweetened medications, which will also be an avenue. And the fact that the parents are so concerned and overwhelmed, they may not be doing the right thing at the right time, doing the oral hygiene practices, effective oral hygiene practices, taking care, and they're so worried about the oral health problems. They don't know what to do. They don't seek treatment, or they are, I want to put this nicely now, they refuse to seek care, because for some countries, especially the developing countries, you find out that there's a lot of taboo around this type of things, and they may not seek oral health care, and the child is more or less abandoned, and the oral health suffers. So it could be one of the reasons that they are prone, apart from the other ones I mentioned.
Yes, indeed. Yeah, there's the stigma, and that has been a problem identified both in India and in Nigeria.
Mm-hmm.
Yeah,
correct.
There's an interesting question about folic acid therapy, and I'll just try to answer that as well, because it is one of the contentious areas in cleft lip and palate. We know that folic acid is extremely important in reproductive health, and we know, for example, that for neural tube defects, that 400 micrograms of folic acid per day in the periconceptional period will reduce the risk of spina bifida and neural tube defects by 70%. So that's a huge effect. that led to a lot of research on whether the same might apply to cleft lip and palate. And unfortunately, the results are not as effective for cleft lip and palate in terms of prevention compared to neural tube defects. There is a marginal effect, it seems, and there's an even more comprehensive effect when you consider multivitamin supplements. So not just folic acid, but other supplements. But a lot of the studies that have looked at this in different countries have come across what's called confounding factors. So the possibility that the folic acid might appear to be working could be due to just a range of other healthy lifestyle choices. Because they're taking folic acid, they may also be highly aware of other risk factors. And they also may have more access and availability to these medications and supplements. So it's difficult to say, but in the countries in the world that introduced folic acid fortification and as part of dietary staple food like flour and like milk, as they did in Ireland and like in rice, they do have a slight reduction in the prevalence. So there could be a marginal effect for folic acid, but what I'm saying is it's really important to take folic acid for reproductive health in general. But different countries may have other factors, environmental factors that also contribute, and even dietary factors. For example, I'm aware in India that polished rice actually removes some of the multivitamin benefit. And rather than eating white rice, it's probably better to be eting the brown rice. And these are subject to ongoing studies to look at the role of diet and prevention of oral clefts. So, and then prevention practices are mentioned there, and prevention both in the context of preventing the cleft, but also in the context of preventing the dental and oral disease. So there's a lovely compliment there to Lola. The question goes to you. I particularly appreciate
snacking in between meals.
Oh yeah, you've actually mentioned that one earlier.
Yeah, I think I talked about it.
Yes. Can avoiding consanguinous marriage prevent incidents? Again, I'm happy to make a brief comment on that one because we did a systematic review looking at consanguinity, and yes, it does increase the risk. We're also very well aware that there's a range of social and cultural aspects to consanguinity, but it is a scientific fact that gene pools, if they're closely aligned, can result in double recessives coming together, and if that is a component part of craniofacial anomalies, then it increases the risk. I did mention earlier the geographic variation, so and said that the reasons for that are largely unknown, but there are regional, geographic, and ethnic differences in the prevalence of both cleft palate and cleft lip and palate. Okay. The mention of Smile Train and its efforts in Nigeria is mentioned, and indeed I think we're well aware of the tremendous support for not only Nigeria but other parts of Sub-Saharan Africa now that Smile Train have been doing a lot of good work also in Ethiopia and Ghana and other parts of Sub-Saharan Africa and Kenya. Yeah. Okay. Cleft orthodontic treatment. There is a question about adult orthodontics, and indeed that is another very important aspect of our ongoing attention. Very often it's regarded as a childhood problem, but indeed these problems can persist into adulthood, and our restorative dentists are very well aware of the need for ongoing restorative treatment, maybe even obturators for facilitating speech and eating in adults. So adult orthodontic and restorative treatment can still be done at any age, really. So does anyone else want to, I think we've come on our chat box to the end of the questions online. And we're very happy to continue, obviously, to support all of those who not only were participating in this webinar, but if you do have questions that arise after this event, then please make sure that you pass these to us and to our colleagues. We're very happy to continue to support this initiative. And of course, the guidelines, we will be using those to good effect for improving cleft care around the world from now on. One other thing that I'll just ask maybe Susanna to comment on, because we want to ensure that we are offering and providing support, is the offer of grants to partners who want to become involved in cleft care around the world.
Yes. So at the moment, SmileTrain does not offer grants, but the goal of the new oral health and comprehensive cleft care guidelines and the upcoming education resources from FDI and SmileTrain with the support from GSK, this is to set the foundation for this grant program in the near future. So please stay in touch with SmileTrain to learn when these become available. Thanks for asking, Peter.
Yeah, and that means that the volunteers can come forward to provide or offer to provide cleft care.
Correct. Yeah, that's correct. And the best is to get in touch with SmileTrain partners, SmileTrain staff. Again, we've shared the websites, smiletrain.org. / oral health care is where you can find the guidelines and also any opportunities to connect with SmileTrain around the world.
And I think maybe that's a very good place to thank everyone for their participation in this. And on that very positive note, we can just recommend everyone to continue to keep abreast of all of the developments that we are suggesting through our guidelines and all of the improvements to ensure that kids are giving the best possible opportunity in life, and that a cleft is no barrier to a fruitful and productive life. And that's our major message. So to keep everyone smiling.
Yeah.
Okay, thank you very much.
Thank you.
Thank you, everyone.
Thank you, everyone.
Thank you, of course, and please allow me to thank, of course, all those present, Lola, Susanna, Peter, of course, our supporters, Smile Train and GSK, and how can I forget all those who have worked in the task team? So let me just nominate them, each and every one. This is, of course, you, Peter. This is Professor Mutu Murugan. This is Professor Lachsen Usehal. This is Dr. Yan Qi from China. And, of course, our staff with the executive director and the staff in Geneva. Many, many thanks. And to all the colleagues, please make a large use of the guidelines in order to help most of people around the globe to have a better life. Stay all safe, and thank you once again.
Thank you very much, Gerhard.
Thank you.
Goodbye.
Thank you, Gerhard.
Bye.
Thank you. I just would like to just add one more thing to invite everyone to celebrate World Smile Day with us. That is upcoming this Friday, October 2nd. This is a day that Smile Train embraces to raise awareness for Cleft and to highlight our partnerships. So along with GSK, we'll be celebrating this Friday. You can visit our website, join us for our live event, which starts at 8 p.m. on Friday, October 2nd, and come along and smile with us.
Thank you, Susanna.
Thank you.
Thank you.